I don't know whether the subject of even the word Alzheimer's makes you uncomfortable, but I hope not, because we're going to be talking about it with a real authority on the subject and what to do about it. Dr. Richard Caselli, the Mayo Clinic neurologist. I saw some stunning numbers that said that by 2050, that the number of Alzheimer's patients, if you will, would have doubled. Why?
The aging population. As our population ages and people surviving longer, it's an age-related disease, and so Alzheimer's as well as other age-related diseases are increasing in frequency.
So often we create a bond between dementia and Alzheimer's. Are they the same thing? And what other indicators are there besides dementia?
Alzheimer's disease is a specific disease. The term dementia is not the name of a disease. It's really a set of symptoms that people have. An earlier stage of Alzheimer's disease would be called mild cognitive impairment. At the mild cognitive impairment stage, a person might have difficulties with their memory that exceeds what you would expect just for normal aging, but they're still able to function more or less independently. By the time a person progresses to the point where we're using the term dementia, you're really no longer able to function independently. And of course, there's mild, moderate, and severe stages of dementia as well. Alzheimer's disease is the most common cause of dementia, but it's not the only cause of dementia.
Help us help the folks right now who are entering into that land called Alzheimer's disease, and help the family members deal with that.
Well, I think the first thing for people to understand is that Alzheimer's disease follows not one predictable course, but it varies a great deal from person to person. And depending upon the age at which it strikes a person, it may be nothing more than a nuisance to them by the time the good Lord comes calling. But if a person, say, is diagnosed with the disorder for the first time at 85 or something like that, well, they have to live long enough for it to reach a stage of severe impairment that would require things like nursing home care or the like. And of course, as we reach those ages, there are other causes of infirmity, not just dementia. So I think in the absence of a cure, the first ray of hope I would like to give at least some of the people listening is that it isn't always a death sentence. It depends upon the individual, and you really have to sort of tailor your crystal ball predictions to that individual's course.
His name is Dr. Richard Caselli, and his specialty is neurology, and the location where he practices, the Mayo Clinic, and you met him on the Arizona Daily Mix.